Well, a warm welcome to today's talk. Now, today I want largely to be looking at this organisation here, Action on World Health, reforming or replacing the World Health Organisation. And this group say we are an international campaign group committed to reforming or replacing the World Health Organisation. I'm going to give you quite a bit of detail on that if you want to stick around. Now, in the UK today, in the Daily Telegraph, Mr. Farage, Nigel Farage, British politician who's actually the chairman of the Action on World Health, he says there's a once-in-a-generation chance to seize back control of health policy from the World Health Organisation. And this sounds indeed like it's an interesting opportunity. Now, the reason he's saying this, Mr. Trump in 2020, his first term, of course, said he was terminating America's relations with the World Health Organization. China has total control over the World Health Organization. Now, of course, we couldn't possibly know that at all, but this is what Mr. Trump said. China has total control over the World Health Organization. This is back in 2020. Who knows, maybe things are dramatically better now. But that's what he said back then. Previously paused funding to the WHO, and funding to the WHO is quite interesting actually. So this is from the WHO's own website here. Now we see that Germany is the highest funder, well over $1 billion. These are millions of US dollars, 1.268 billion from Germany, and then second comes the Bill and Melinda Gates Foundation. $751 million. Then the United States, then the United Kingdom, European Commission, and many others. I think China, from memory, was about $40 million. So Bill and Melinda Gates here, Foundation, this is 2020-21, data from the WHO. Largest funders, apart from Germany, to the WHO. I don't really quite know why that is, but you might have your own ideas. Do let me know. Anyway, moving on. This is back to Mr. Trump back in 2020, because they failed to make the requested and greatly needed reforms. We will today be terminating our relationship. Now, this didn't quite happen, of course, because the Biden administration took over. Whether Mr. Biden took the decision himself, or whether it was his groupings took the decision, I don't know. Anyway, let's look a little more about what this organisation is saying. Founded on noble principles, the World Health Organization has strayed away from its core objectives to attain the highest level of health for all people, prevent disease, provide essential healthcare services globally, and promote international collaboration in health. Now, they, of course, are the noble objectives. And let's be quite clear, we really, really support global coordinated health improvement. Of course we do. We really support that. The question is the World Health Organization the optimum way of doing this? Or could there potentially be a way that's a little bit better? Let's read on. From a sluggish response to the Ebola outbreak, dubbed an egregious failure to its complicity in China's cover-up of COVID-19, the WHO has repeatedly let the world down by building a global health empire that takes power away from countries and citizens. Pretty strong words from this World Action on World Health group. Do let me know if you agree or disagree, of course. We believe countries should cooperate on health issues and that the WHO should respect sovereignty and stop interfering in people's lives. The WHO should stick to its role, sharing information and providing guidance, not dictating policies that override national interests. Wow, well, interesting words. Let's just carry on with the context. Back to 2024, Mr. Farage says, believes Mr. Trump's second presidency, the impetus for curbing the powers of the WHO. Critics of the World Health Organization fear In future, WHO will dictate policies to sovereign nations. In other words, the fear here is that the power of the state could be taken over by the World Health Organization and the power of the state weaponized against individual citizens. Some people might think this is happening already in other areas. A new pandemic agreement scheduled to be agreed in May 2025. That's according to the Telegraph. Now, this has been a bit confusing. I don't pretend to be up to date, but that's what the Telegraph is saying in May 2025. New pandemic agreement. And of course, we've got the health accords and all sorts of things that we have talked to James Roguski about, who's kept an eye on this for us, and we'll put a link to his site if you want to be bang up to date on that. Fears that the new treaty would be legally binding on all 194 member states. God, sounds like a world government, doesn't it? 194 member states under one auspices. Fears WHO mandates lockdown vaccination campaigns during the pandemic. So would the WHO be saying, all right, off you go and get this new vaccine? These are fears people have. Now, Mr. Farage on the WHO said it was founded on noble principles, and it was indeed. But it has repeatedly let the world down while building $1 billion global health empire that takes power away from countries and their citizens, according to Mr. Farage. Action on World Health has now commissioned a review of the WHO's functions, led by Dr. David Bell, former WHO medical officer, and 9 other experts in medicine, law and ethics. The review will examine powers and structures of the World Health Organization, recommend reforms, or possibly replace it with something else. Let me know if you think the WHO can be reformed or whether they just need to start with a clean sheet of paper. Has it just gone too far? Let me know what you think. Dr. Bell and his team would recommend reforms that respect national sovereignty and stop interfering in people's lives. Dr. Bell says this: I and my colleagues have been increasingly concerned with the departure of the WHO from its roots. We care passionately about international health. We couldn't agree more, Dr. Bell. We really couldn't agree more. And I think if you were here now, you would say it's how we achieve that. I would say, how do we achieve that? What is the optimum way to achieve international health? Could this be being done better? And with the right set of reforms, can improve health of all peoples. So Dr. Bell here, wanting to improve the health of all peoples. Of course, we emphatically endorse Dr. Bell's sentiment. Restore national ownership. Sounds good. Protect bodily autonomy. This is all Dr. Bell speaking. We agree. End conflicts of interest. Absolutely. And restore good governance. If the WHO could not be reformed, Dr. Bell said, it would have to be replaced by a body more fit for purpose and reflecting the will of the world's people. Well, wow. Reform or replace. It's about power. They want more, apparently. Money, health, a new team. Sounds good. To save public health. We all, watching this video, you and me, have that same desire to improve the health of the people of the world. Otherwise, I don't think you'd be watching these videos. And if there were people who don't have that interest as the centre and core of their raison d'etre, then that would be unfortunate, because that's what we want. We want to improve health. We want to reduce human pain, suffering and death. It's really very simple. If only the world were that simple. Interesting things happening. Do let me know what you think. As always, thank you for watching.